let's talk about a case that should never have happened. Okay, so but did, and not just once. A patient in a critical case setting was prescribed ceftriaxone. At the same time, they were receiving IV calcium. Okay, typically calcium gluconate or calcium containing fluids. On paper, this is normal, but the drugs are valid. Both are commonly used, no issue, until someone stops thinking and starts assuming the mistake. Can you please elaborate this?
Pharmaceutical incompatibility can be defined as an undesirable interaction that occurs when two or more substances are mixed together, leading to changes in their physical, chemical, or therapeutic properties. These changes may result in the loss of drug efficacy, reduced stability, or even harmful effects on the patient. In daily pharmacy practice, especially in hospital and community settings, multiple drugs are often prescribed and sometimes combined in the same dosage form or administered together. If proper care is not taken, incompatibilities may occur, which can compromise patient safety. Pharmaceutical incompatibilities are generally classified into three types: physical incompatibility, chemical and therapeutic incompatibilities. Physical incompatibility, which involves visible changes such as precipitation, turbidity, color change or phase separation. Second, chemical incompatibility, where chemical reactions like hydrolysis, oxidation or complex formation takes place, leading to the degradation of the drug. Third, therapeutic incompatibility, which occurs when pharmacological effect is one drug is altered. Third, therapeutic incompatibility, which occurs when pharmacological effect of one drug is altered by another, either reducing its effectiveness or increasing toxicity. The study of pharmaceutical incompatibility is essential for pharmacists because they play a key role in dispensing, compounding, and advising on the drug use. Identifying potential incompatibilities, understanding their mechanism, and taking preventive measures are crucial responsibilities of a pharmacist. In this case study, we will explore a practical scenario where incompatibilities has occurred. We will analyze the cause, identify and the type of incompatibility involved, and discuss the steps that could have been taken to prevent it. Thank you.
Right. When exposed to acidic condition, it undergoes hydrolysis. That means water added by low pH breaks the ring open. Once that ring is broken, penicillin is no longer active, not weaker, not slightly reduced, inactive. So what you have essentially done is given the patient a drug that looks fine but doesn't work. And this is where it gets dangerous, not immediately, but clinically the infection doesn't respond, the patient doesn't improve, the doctor might think the bacteria are resistant. Stronger antibiotics may be prescribed unnecessarily, all because someone ignored one bad factor, pH. Now look at the mistake pattern. First, no, what is that? I asked, no consideration of pH compatibility. People focus can these drugs be mixed, but ignore what environment does think drug need to stay stable.
Talk about the case that should never have happened, but did, and not just once. A patient in a critical care setting was prescribed ceftriaxone. At the time, they were receiving IV calcium, typically calcium gluconate or calcium containing fluids. On paper, this is normal, but drugs are valid. Both are commonly used. No issue until someone stop thinking and stop assuming the mistake. Administration. Both were given through the same IV line, either at the same time or one right after the other, without flushing. Some decided it's probably fine. That probably is where the problem begins. Inside that IV line, this is not just mixing, it's a reaction. Ceftriaxone 1 has high affinity or for calcium ion. When they meet, they did not stay dissolved. They form an insoluble ceftriaxone 1 calcium salt. This is a textbook case of pharmaceutical incompatibility. Now understand the seriousness. This compound does not dissolve in blood. So instead of clear, safe solution entering the patients, you have solid particle precipitates forming in real timing and entering circulation, and the body does not just handle it. These particles travel through the bloodstream and